And it goes a little something like.
Good afternoon, ma'am. I'm Nurse Kristel and I am your nurse for today. Ma'am, may I know what is your name?
Gigante,
How about your age, ma'am?
41 years old.
Okay, ma'am. The purpose of my visiting here today is to clean your wound, okay, ma'am?
Okay.
But first, ma'am, please allow me first to arrange my equipments that I will going to use. Is it okay with you, ma'am?
Okay.
These are the equipments that I will going to use. I have 2 pairs of clean gloves, and then the cleansing solution, and I will use the betadine as my cleansing solution, the adhesive tape, the bandage scissor, the plastic bag, and then of course the gauze. And then this time we will going to use the small gauze and then the large gauze. And then I also have extra twister here for cleansing the wound. The first thing that you need to do is to wash your hands or do the hand hygiene. And then after it, you need to put your gloves. Okay. Okay, ma'am, we will start now the wound care. Is it okay with you, ma'am?
Okay.
Remove now the old dressing. Loosen the edges of the tape and peel the tips of the skin by pulling them towards the wound. Take note also if the dressing sticks to the wound, pour a little cleansing solution and let it sit for a minute. Inspect also the wound carefully and report immediately to the attending doctor if you see the following: redness, bleeding, swelling, wound separation, maceration, and drainage from the wound. After the procedure, discard the dressing and the tapes to the plastic bag. Next, get the twister and get the small gauze for the cleansing of the wound and put the betadine or the cleansing solution top to bottom, and then discard the small gauze. Take note also the 1 stroke per gauze or per cleansing. And then repeat the procedure, top to bottom again, and then discard the gauze. Don't forget to close the betadine or the cleansing solution and remove the gloves. Discard again the gloves in the plastic container and then do the hand hygiene. Next, open the package with the large gauze dressing. And then do the hand hygiene again. And then put another new gloves or the another pair of new gloves. Next is pick the gauze dressing and hold it at 2 diagonally opposite corners, centering the gauze pad over the wound and securing it in place by using adhesive plaster. By the way, if the patient's skin is allergic to the adhesive tape, hypoallergenic tape, bandages, or binders can hold the dressing. Okay. And then we will apply the last tape. We will put the last tape on the middle portion of the gauze. Lastly, you need to remove your gloves and discard them into the plastic bag and seal the bag securely and discard it to the trash. And don't forget to wash your hands and do the hand hygiene. And that's it, ma'am. We were now done in the procedure.
Okay.
And lastly, don't forget to record your procedure or the observations that you observe or done.